All right. Good evening, everyone. Thank you for joining us for tonight's webinar on transforming health benefits for First Nations. My name is Jeremy Hia, and I'm one of the pharmacists here at PCPHA. Tonight, we have the pleasure of having representatives from the First Nations Health Authority and Pacific Blue Cross who will discuss the upcoming changes to pharmacy services for First Nation patients. Before we begin, we have an elder, Sequalia, who will open us with an opening prayer as well as land acknowledgement.
On Hoff and Swallowin, Quisquake, Quachnomi, Tanoyapan, and Siayite, to Squalls to Seats. I'm just saying that I'm really glad you all came here, all of you who are on the line there, and I can see your little pictures and phones, and that Kayachtan, I welcome you to FNHA's Transforming Health Benefits for First Nations in BC. And I'm Sequalia Ann Wanick from Squamish Nation. I'm the First Nation Health Authority's knowledge keeper, and with Shane Point to Taton. And tonight is about coming together and sharing information and learning from one another, and hopefully having you all put questions forward and answer them and be able to come to understanding so that we stand and work together to hold each other up, support one another with being able to move forward and taking care of all the First Nation people in BC in the best way possible. And so it's Blue Cross working with FNHA and the pharmacy. So I'm really grateful you have over 300 people, did you say? Over 300 of you are interested in finding out about this. So it's an honor to be able to share with you tonight. I'm going to do Sequalia's song. That was my grandfather's auntie. She was alive during the late 1800s and early 1900s till about 1910. And this is her song called Sequalia Slolum Ha Squile. And it's Sequalia's song, greeting of the day. And I was named after her when I was 14 by my grandfather and Uncle Louis Dominic Charlie, and my Uncle Louis Miranda. So this is, I carry the song now with my daughter Josephine, who also is Sequalia, but also carries Sequalia's daughter's name, Sakona Coast. And so I'll share the song, do a prayer, and then turn you over to the team and wish you all well. Keep your hands open. I'm asking everyone, wherever you are, keep your hands open. While I sing the song, I'm going to ask you to all come together in Chomot Squalwan, not Smot, be one, and pray together for all of our family and friends. And then I'll say the prayer. Oh Shankwamentomi kakakana chasiam. Yons so tanoy up in manman to squalls to seats. Yonsio manman squalwen snachem se sop sequadal chet to squalls to seats. Asking you, Creator, to help and watch over all of your children that are part of this gathering tonight, to help with their squalwen, their mental, emotional, physical, spiritual well-being, and to help also their families, sequadal chet, all of their families with their squalwen. Asking you, Creator, to help all of your children and guide them as we share words tonight, and we listen to the words and take them into our heart and mind. Put aside what isn't needed tonight, but keep in your heart and mind what's meant for you, and be able to speak the snachem, the words, and see the words on the presentation or on your computers. Speak about those words, to use them for your the work that you do today and into the future. Asking prayers, kakakanek chasiam, for all our family and friends who have serious illnesses, the many cancers that are out there, the heart problems, diabetes, HIV, AIDS, tuberculosis, and many other illnesses, many forms of arthritis that is causing people pain, and for those who have serious injuries and needing surgery. Asking prayers for all of them for their health, healing, and recovery. Kakakanek chasiam, hear our prayers for those who are of our family and friends who are battling drugs and alcohol, especially in this time of opioid crisis and losing a whole generation of young people that aren't going to make it into old age. And pray for those incarcerated because of their addictions, and for all of their families who don't want to lose them. Pray to help them, and that those addicted find that healing path to detox and recovery and live. Asking, especially today, International Suicide Prevention Day, help them with their traumas so they don't want to leave this earth. Asking prayers for all the people that have depression and anxiety that might lead them there, and asking them to reach out to people. This month is Suicide Prevention Month. We need to help them so that others, their families, aren't hurt because they leave this earth. Asking prayers for all of those who have lost loved ones, who might feel pain in their heart and grieving and sorrow, to know the pain doesn't go away, but it changes, so that one day you don't think of your loved one in grief and sorrow, but can have feelings of at least smiles and good memories and the good times you all had together. And they send you signs like a dragonfly, a butterfly, hummingbird, eagle, even sometimes crows or ravens. So know that they send signs when you need them, and they're always with you, and worry about us because they don't have any they're finished their life journey and don't have the same everyday survival problems we do, and so they worry for us. Asking prayers that tonight's webinar, or if that's what you call it, goes well tonight, and that you all come together and share in a good way all the different views and hear the presentation, and that all of you get seen safely home at the end of tonight. Tama kwetsi snachum. Hoichacha, thank you.
All right.
Okay, I'll see you all. Take care.
Thank you, Sequoia, for the song and opening us up for this evening. Just before we get right into the material for tonight, just a couple of items. So a bit of housekeeping here. So we're going to do question and answer for sure, but we ask that if you don't mind just typing up your questions as illustrated on this graphic here, and not use that middle button that you see right next to the smiley face, so that way we could see your questions as you type them, and we'll go through them at the end of the presentation. Another thing is that if you ever get disconnected at any point, just use the same link that you used to log in onto this webinar, and it'll just allow you to rejoin again. And just one last thing is just keep in mind that at the end of the presentation, we'll link you through a evaluation, which would redirect you to your statement of completion. This session is accredited for 2 hours, SEEP accredited hours. And all right, so without further ado, let's just go right into the presenter disclosure, and I'll just have the speakers that we have today to introduce themselves.
Sure. So from Cindy Preston, I'm the Senior Pharmacist Lead from FNHA. So myself and the following presenters have no current or past relationships with commercial entities and have not received any speaker fees for this learning activity.
I'm Connie Chong, the Manager of Provider Relations for FNHA.
I'm Reva Pickering, Registered Pharmacy Technician. I work at Pacific Blue Cross as a Pharmacy Services Analyst.
And I'm Carlos Sorensen, Manager of Claims Services at Pacific Blue Cross.
I'm Laura Dale, Manager of Claims Policies and Standards at Pacific Blue Cross.
And I'm Wendy Watkins, Senior Manager of Operational Solutions at Pacific Blue Cross.
All right, so we're going to jump right into the learning objectives. So hi everyone on the line, and this is really exciting times. We did speak to you back in 2017 when we transitioned the drug plan into the provincial pharmacare plan W. So now we're here for the second part, and the learning objectives today is to really make sure that pharmacists are aware that on September 16th, 2019, FNHA is completing that transition from the federal non-assured health benefits program. So medical supplies and equipment benefits and select drug benefits will be administered by Pacific Blue Cross. The other learning objectives include recognizing the client pathways and understand how to navigate the processes to help First Nation patients obtain the benefits they require. For number 3, we want to make sure that pharmacists have an understanding of the FNHA's benefit plan changes and the new claiming procedures to prepare for the transition. And 4, we'd like pharmacists to be familiar with the resources available to support pharmacists to address and resolve any coverage issues or claim issues, and also some resources to provide more information about how cultural safety and humility in practice impacts healthcare. Okay, so an outline. We're going to talk about the FNHA transformation journey, an overview of the transition to Pacific Blue Cross, client eligibility and possible client pathways, enrolling clients in Plan W. We're going to talk about the new MS&E plan, the new medical supplies and equipment plan. We're going to talk about the supplementary drug benefits that are going to be available through Pacific Blue Cross, as well as the processing claims and some troubleshooting, and then the resources available to pharmacists and pharmacy staff members. So we're going to jump right in with introducing the First Nations Health Authority. So many of you may be familiar with some of the history leading to today. We've picked from the story of FNHA and First Nations Health transformation some of the key milestones since 2005. So in 2005 and 6, the Transformative Change Accord came about and the First Nations Health Plan. This agreement was with the provincial government and First Nation health leadership to close the gaps between the health of First Nations and the BC residents. So they looked at health, education, housing, and economic opportunity. In this agreement, it was really about establishing a new relationship based on recognition and mutual respect. So in 2012, the tripartite partnership was developed. So this was bringing on the federal government into these conversations as well. So this then, there were a series of meetings and a lot of governance work that was completed, which led to the First Nations Health Authority being created and the agreement that FNHA, the First Nations Health Authority, would take over control of that federal programming and the federal health benefits and the federal responsibility for the First Nations health here in BC. So the creation of the First Nations Health Authority was in 2013. So as you guys know, there was a transition in 2017, and this is where the First Nations Health Benefits Program transitioned the drug benefits to Plan W, to the First Nations Health Authority plan in the pharmacare program. So in the last few years, there's been a number of pharmacist engagement and training sessions, FNHA working with BCPHA to make sure pharmacists have the tools and the tricks and the information they need to be able to provide the pharmacy benefits in the drug plan. During that same time, there was a community engagement team created. So this engagement team was to reach out to community and to providers and to further inform how FNHA would address the remaining federal benefits that exist on the federal system. So it brings us to today, here in September 2019, where we are right at the point where we are addressing the residual federal benefits and moving them off that federal system. So we know there's more changes to come to the benefit plans themselves in the future, but we are realizing on September 16th, 2019, full First Nation control over our benefit program here in BC. So one of FNHA's key priorities is around cultural safety and humility. And there's still a lot of work to be done within the healthcare system around cultural safety and humility. So cultural safety is the outcome based on respectful engagement that recognizes and strives to address power imbalance inherent in the healthcare system. It results in an environment free of racism, discrimination, and where people feel safe when receiving health care. Cultural humility is a process of self-reflection. So cultural humility is where healthcare professionals can understand the personal and systemic biases to develop and maintain respectful processes, relationships based on mutual trust. Cultural humility involves humbly acknowledging oneself as a learner when it comes to understand another's experience. So in 2006, when there was a big focus on changing the relationship of healthcare and the healthcare interactions for First Nations here in BC. This slide here represents why there is a First Nations Health Authority. So again, the First Nations Health Authority was created to provide that holistic First Nations perspective on health and wellness. The First Nations Health Authority works at all levels of the healthcare system to strategically and simultaneously address many, many issues. Articulating the First Nation views about health and wellness to develop policies and benefits that work for First Nations, ultimately with the goal of empowering individuals, families, and communities to be self-determining and empowered around their health care. At FNHA, it really is all parts of the healthcare system that are being impacted, and there's First Nations at the table. So again, we hear where First Nations are no longer invisible in the systems that they're trying to access services from. I do want to take a minute here. I really think this is a really big moment for pharmacy when we talk about the transitioning of all of the benefits and the services we provide as pharmacists to our patients, when this actually is moving off a federal system and moving into a system where the First Nations have a say and are guiding where the benefit programs and how they will evolve into the future. I had an elder come to me even after the October 1st transition, actually almost a year after that point, and says, great, you transitioned, we are starting to make differences within our drug benefits, but why? Why are we still being claimed through Indian Affairs? Why is that conversation still happening? What haven't we addressed? And I have to admit, it was one of my blind spots. I didn't realize what was actually happening. So what I'm going to share with you guys today is a self-reflection that I've realized, and an example of the system biases that are inherent just within our own pharmacy systems that can impact Indigenous patients and the way that they interact with our pharmacy services in community pharmacy. So the example I have is, we all know, like, our pharmacy software has been set up traditionally to bill for First Nation individuals. we build a non-assured health benefits program. When we bill, we actually bill, and our software is often identified as IA, Indian Affairs. So Indian Affairs, Medical Services Branch, Department of Indian Affairs, Medical Services Branch, they're all federal departments that were responsible for Indigenous health historically at one point or time. Right now, we have Indigenous and Northern Affairs Canada, INAC. That department really is responsible for the Crown and Indigenous relations, treaties, the Truth and Reconciliation, and all of those conversations, and the call to actions for the Canadian government and for Canadians, and as well as the work around the murdered and missing Indigenous women. So we also have the new Department of Indigenous Services Canada, which is now where the non-assured health benefit program sits in that department, previously in Health Canada. So these changes within the federal system have changed many times, and it reflects the changes in the relationship of the federal government and First Nations people in Canada and in BC. So when our software sticks back in the past with Indian Affairs, we have to think about what that conversation, what impact, what journeys our patients have been on, and how that actually may bring someone back in time to previous traumas. So we talk about cultural safety, and we do have talks about trauma-informed care. So it has kind of been a blind spot around this. So the reason why I'm saying this is when we talk about Indian Affairs not covering your medications, or we're billing Indian Affairs, or this isn't covered by Indian Affairs, these conversations, or just that wording with no intent, but that actually means something very, very fundamentally different to some of our First Nation individuals and the experience they've had in their own lives or in their families' lives. For example, it really is, it triggers people back to the Indian agents coming to take the children away, to go take them and send them to residential school. It's that dictation of visitation of when they can travel on and off reserve. It really is the residential school experience of being dehumanized, and really having those government policies dictating what you can and cannot access and how you access it. So for me, this change symbolizes a massive change that we have here for our First Nations in BC. No longer will we have the IA for our First Nation Health Authority clients. They will be moving off that federal system, and the claiming system will actually change. So really, it represents a new way, a new plan, and an opportunity to provide services and have services accessed in a more positive way for many of our First Nation community members. All right, so the First Nations Health Benefits Transformation Journey. So like I said, September 16th, 2019 is a big day. Pacific Blue Cross will become the third-party administrator for the following benefits: the dental plan, the vision plan, medical supplies and equipment, and for drugs, the drugs that are on that supplementary drug list, as well as for drugs that for patients who are not yet enrolled in Plan W.
So for the past year, we've listened with big ears to learn what works and what doesn't work when it comes to health benefits, and to gather ideas on how to transform care. So our team has traveled to First Nations communities around BC, and we've conducted focus group sessions with community members and have gotten feedback from health leads working in communities. We've also interviewed pharmacy providers, including the BC Pharmacy Association, pharmacy chains, and top pharmacies that work closely with First Nations. Now, one of the interesting things is, even though we've interviewed a range of communities and health providers, the striking message across the board was that we really needed to improve our administrative and adjudication processes, that medical supplies and equipment benefits coverage for BC First Nations was substandard, and that unsafe healthcare interactions continue to be a barrier for our clients. So this was a quote from one of our community focus group sessions that really speaks to the importance of why we are transforming benefits and the great need to remove systematic barriers, like Cindy mentioned, to support First Nations health and wellness and to support First Nations to be self-determining. We're starting to really see good changes in the healthcare system as the climate for change is growing. Cultural safety is being hardwired into the healthcare system through actions like declarations for cultural safety and humility with our partners like Pacific Blue Cross and the College of Pharmacists. And over the past few months, it's been really inspiring to see hope from both our clients and providers for improvements to medical supplies and equipment and drug benefits for First Nations.
Thanks, Connie. So I'm just going to jump into the FNHA client eligibility. So when we talk about client eligibility, this is really answering who are the FNHA clients. So FNHA clients have status. It could be an infant up to 18 months old that does not yet have their status number as well. There is a requirement to be a resident of BC according to the Medical Services Plan. And the individual cannot be funded or insured by any other benefit system or plan, federal or self-government agreement. So there are some First Nations here in BC that are completely self-governing and have their own health benefits program. So some of you may be familiar with the Nisga'a Nation. So their membership, they have a separate benefit program for them. The Inuit, they have their benefit plan continuing through the non-assured health benefits program. Mohawks of Askasassani and Big Stone Cree are other examples of the self-government agreement that provides their health benefits. So the following First Nation individuals who may meet the criteria above are not eligible for the benefits of the program. So if they're not a resident in BC, if they're incarcerated, or if they're in a provincially or territorially funded institution. So really that would mean, again, if you're in a hospital, you wouldn't have, like the drugs that you and the services you receive will be provided through the medical services plan in the hospital versus the actual benefit program. So I'm going to move to speak about the client pathways to access benefits from pharmacies. So as you know, most FNHA clients are enrolled in Plan W now. So FNHA enrolls clients in Plan W through the MSP programming. So we do know we have about 10% of our clients that are not yet enrolled in Plan W. I'm going to speak about the significance of this and the processes we have related to this in a few minutes. For these clients, we have 5,000 of these clients who have been having their claims for the drug plan primarily and solely flow through NHB. The remaining clients, of these clients, there may be clients that do have private insurance or have not accessed any benefits at all. Okay? And for these 10% of the FNHA clients, ongoing work is going to be done by FNHA to ensure that all clients are enrolled in Plan W. This is ongoing work, and it won't be done quickly. It is a matter of FNHA being able to connect with patients and receive their PHN so that we can put them in our MSP group so they can access the Plan W benefits. All right. So for the pharmacist supporting Plan W enrollment requests, for that 10% of the FNHA clients that are not yet enrolled, we would really encourage pharmacists to encourage the FNHA clients not yet enrolled to contact FNHA. They can call the 855-550-5454 number, and the client can request the Plan W coverage. If that's not possible, and if the pharmacist is willing to support the FNHA clients, we would accept this by fax. We would like pharmacists to support clients by submitting the transitional coverage request form, which really is that form if there's a transitional issue, pharmacists can provide a benefit or tell FNHA what the issue is in this case and submit that to FNHA, along with a signed MSP application. And we have an example of it here, and we do have the links attached, and we can provide those out to patients later, or to pharmacists after. We want to ensure that the MSP application is signed by the client, and the pharmacist has an opportunity to talk to the patient about enrolling in the plan, the FNHA Plan W, really to make sure they have the most streamlined access to their benefits moving into the future. For pharmacists that are supporting clients to enroll in Plan W, FNHA is providing a $10 support fee. The MSP application is very important. It provides us the patient information, their PHN, as well as a request and consent to put them into Plan W. It provides us the contact information if we do need to follow up with them about their own information, or even their family members' information too, to make sure that their dependents are also enrolled into Plan W appropriately. Okay, so we're going to move into talking about the new plan, what you guys are going to see and what our First Nation individuals are going to be accessing after September 16th. So you might recognize our umbrella. This is how we demonstrated how coverage for the drug plan and through pharmacy was available after the transition to Plan W in 2017. So you can see here we have a new segment of our umbrella for Pacific Blue Cross. So Pharmacare is the primary drug plan for First Nations here in BC. All First Nations can access other Pharmacare plans if they are eligible and or enrolled through the mechanisms that exist. Clients should be accessing provincial agencies. The special authority drugs exist, and then there's Pacific Blue Cross with medical supplies, equipment, and the drug benefits for patients not yet enrolled.
Hi everyone, it's Laura Dale here from Pacific Blue Cross. I have the privilege of giving you a high-level overview of some of the medical equipment and supply benefits, in addition to, like Cindy mentioned, the supplementary drug benefit and the drug benefit claim process for clients not yet enrolled in Plan W. So with regards to this, as you can see pictured here, we have a beautifully updated pharmacy reference guide, which I'm sure you have absolutely downloaded and have in front of you right now as we speak. Knowing that that's not true, you can navigate to pacificbluecross.ca/provider and download this beautiful document, because it will be the providing support for all of the resources that you will need to be able to implement this incredible plan that is going to be launching on September 16th. We have listed a few, examples of some of the benefits that will be covered. Wound care is one that we will be talking about in greater detail. Certain over-the-counter limb and body orthoses, in addition to some pressure garments. Audiology is listed here, but it's just batteries for hearing aids for you pharmacies. In addition to the fact that this reference guide is featured here, there is a brand new document which is called the Pharmacy Fee Supplement, which is going to provide all indications for the medical equipment supply benefit list that I just indicated, and the supplementary drug formulary as well. To set up PBC billing for First Nations clients should be quite simple. One of the fundamental tenets, though, is please do not delete the First Nations status number from a patient's profile. We are using status numbers as the First Nations client's ID, which is the 10-digit status number. For simplicity's sake, we have assigned a PBC group ID, which is 40,000. Some First Nations clients may come in with a PBC ID that will have this, but the primary way that you will be seeking the identification number is through the status card. So for new clients, we highly recommend that you accept either one primary ID or two secondary IDs to validate the status number. However, we do realize that there could be certain circumstances where there might not be a status number, or perhaps it's incorrect. And so please do not hesitate to call the 1-855 number indicated, or quickly email healthbenefits@fnha.ca. My personal favorite topic is medical supplies and equipment. So as of September 16th, any claims submitted to NIHB will be rejected. And so this is your opportunity to start transmitting those to Pacific Blue Cross. When you have the fee supplement indicated in front of you, you will notice that there are certainly fewer PINs and predeterminations. This allows you to be able to support clients' medical health and wellness with simpler processing on the back end. Our guide is set up in a way to allow for modifications. We know that this is going to be an evolving plan, and so we have posted sections in the guide that refer to current PINs and retired PINs. So please do ensure that you always download the latest version of the fee supplement to make sure that you are staying up to date on any changes that may be made. We are hoping that what you will see is similar but simpler coverage. One of the big indicators here is the retail pricing for items. We are imagining that this is going to be standard practice for Pacific Blue Cross, which will be using the drug cost, the product value, and the cost upcharge for electronic MS&E claim items. However, if there are claims that are transmitted to us for medical equipment and supply PINs using professional fees, compounding charges, or special service fees, these will be rejected. Standard practice, again, PBC can return up to 5 CPHA response codes, plus 3 short text messages to explain the claim payment and or the reason for refusal. Diving into the wound care change, I think you will find that this is an opportunity to provide point of sale service that is going to reduce barriers in terms of access. So wound care supplies are now listed in one of 2 groups. In the Group 1 category, clients can accumulate $30 a year with no questions asked. Clients do not need to submit a prescription or a prior authorization. This is when you need to support a client at point of sale for the certain products and services that would support them before they walk out of your store. For Group 2 benefits, clients can receive up to 20 items, or they can accumulate a total of $200 every 6 months. This $200, it should be noted, also includes claims for supplies. These items are more expensive and do require a prescription from a physician or a nurse practitioner. However, to reduce barriers to access, providers do not need to submit this prescription to Pacific Blue Cross. We expect that you'll be retaining these on file in case there's any additional requirements needed from Pacific Blue Cross. However, we do realize that there will be clients with special needs who may require additional limits beyond those that are posted here. So in this circumstance, if you have a client that has additional needs, you'll have to fill out the wound care assessment form, which will be posted on the website, for Pacific Blue Cross to review and to apply the appropriate predetermination amount. Here's another example of some of the new features of the plan, specifically around the diabetic equipment changes. These are for clients not yet enrolled in Plan W. For clients not enrolled in Plan W, the experience should be very similar to those involved in Plan W in terms of the access to the services that they are eligible for. With regards to the formulary posted here, we do suggest that you use the BC Pharmacare quantity submission guidelines whenever possible, and ensure that you are submitting the appropriate Pharmacare PIN or the equivalent Pacific Blue Cross PIN. As many of you have asked me thus far, the key piece of information that is brought up is regards to the configuration changes that are required to the pharmacy practice management software. So Pacific Blue Cross, in partnership with the association, have been working very closely with all of the software vendors to be able to ensure that your systems will be configured for go live. One key piece of information, of course, is to update the FNHA client information to indicate Pacific Blue Cross as the carrier, and our carrier code is E1. So pharmacies are suggested to submit claims to Pacific Blue Cross using the Pharmacare and or the Pacific Blue Cross DINs/PINs for the claim submissions. All of these PINs are indicated in the First Nations Health Authority fee supplement. And it should be noted that for Go Live, the only policy that's eligible for the claim submission of PINs through EDI is Policy 40,000, which is First Nations Health Authority. We will be working on enhancements in the future for the rest of our policies. So please note that pharmacies will still have to have access to the NIHB Express Scripts plan in their system. This is especially important for border pharmacies where you may have NIHB clients frequenting your store in addition to FNHA clients as well. Of course, there's coordination of benefits conversations where a First Nations client is the secondary plan to a private carrier. The pharmacy will still need to submit the sum of all amounts paid by previous plans in the previous paid field. If you are experiencing any technical difficulties, please do contact your software vendor if you receive any centralized updates or manually configure your software as per usual business practice. So we did have a question come in about non-FNHA clients who are visiting the province. So visitors to BC would not be covered through BC Pharmacare or FNHA. You would need to bill NIHB if they are enrolled in that program. So I do know that many of you on this call are likely with the Kroll software or perhaps PharmaClick, and I do know that they are going to be announcing their software changes as of September 14th, and everything seems to be going very smoothly. So if you haven't heard anything, it's likely because they will be posting their final update on Friday. But if there is any issues or concerns on day one, please do contact your software vendor.
Hi everyone, it's Carlos Sorensen here with Pacific Blue Cross. We're just going to take a look at the predetermination process. So once again, really important that you get familiar with the FNHA fee supplement to see if there is claiming criteria required with a predetermination. We will be loading 2 years of client history for medical supplies and equipment, and we will have those on our file. You can download provider health claim form from our PBC website as well. You can select predetermination at the top of the claim form, fill in sections 1 through 3, and signatures are not required when you're submitting just a predetermination. Please ensure that you're enclosing copies of all supporting medical documentation as outlined in the FNHA fee supplement. And these can be submitted by mail or by fax to the 677-0277 number. If additional documentation is required, PBC will reject the predetermination and provide the reasons. Please submit additional documentation as a new predetermination or with the missing information and reference the rejected Predi ID number and or attach a copy of the explanation of benefits that came with your rejected original predetermination.
Sorry, Carlos, I'm just going to interject. I have a question from a pharmacist asking what a predetermination is, because I think the language in pharmacy is more pre-authorization.
Predetermination equals pre-authorization, just like pre-authorization equals predetermination. So our forms have the predetermination language or verbiage on them, but they are one and the same. So it's just a product that requires a submission that meets certain criteria before eligibility is confirmed and before claims can be submitted electronically. In the same line, an approved predetermination or pre-auth will enable electronic claim submission. So once you've gone through that process for that particular service for medical supplies and equipment, then you can go ahead and submit the claims electronically as well up until If the predetermination indicates a certain amount of period of time that the services are eligible for, if it's a couple of months, or a certain amount of frequency of that service, you can also go ahead and submit them electronically up until what's indicated on the approved pre-authorization or predetermination. Ineligible benefits. So claims that are not eligible will get a response code of C1, not a benefit. This means that either the item is not eligible in the plan, or it's not eligible to be, submitted electronically. So it's really important at that point in time that you take a look at the fee supplement to confirm if that PIN that you're trying to submit is just requiring a pre-authorization to be submitted for review, or if it's simply just not a benefit under the FNHA plan. For manual submissions, claim response code A6, submit manual claim, will be the response that you will see when you try to submit that electronically. And again, going back to our wonderful provider health claim form, you can look at the steps that are required there with submitting that manual pre-auth. In addition, please refer to the PBC Pharmacy Provider Guide section, FNHA Claiming Procedures, on how to submit on behalf of FNHA clients if you have any questions.
Great, thanks, Carlos. So I'm going to move into a case study around the medical supplies and equipment. This might help answer some of the questions around how MS&E are priced, as well as what do you mean by Group 1 and Group 2 of medical supplies and equipment or wound care supplies that I can provide with or without a prescription. So in case study 1, we have Lana and Sam. They were doing some home renovations. An accident happened and Sam suffered second-degree burns at home. He requires wound care supplies including gauze, tape, and silver alginate dressings. So the question here is, what coverage is Sam eligible for on and after September 16th? So this is where reference to the fee guide is really, really important. If we take a look at Group 1, just to give you an example, Group 1 items contains many very simple wound care supplies, gauze, tape, most of the lower cost, simple wound care items. Group 2 contains the more expensive and more complex wound care needs. So Sam is eligible for wound care supplies from both of these groups. For Sam, if he needs a few bandages, a little bit of gauze, some tape, the pharmacist can provide that at point of sale. Okay? The pharmacist can be billing retail costs. For medical supplies and equipment, we are moving towards a retail cost system for pricing. So Sam will show up at the pharmacy, and the pharmacist can provide very basic wound care supply for him. Sam is going to return a little while later with a prescription because he did have quite a severe burn, and it is oozing, and with a prescription for the silver alginate dressing. So the silver alginate dressing is in the Group 2 category, requiring a prescriber prescription. So I am going to back up. For any wound care supplies provided out of Group 1, the pharmacist will have to document what they provided, the same type of information that you would for any other prescription like item or other item you're providing through your own license number and through your own authorization. So when Sam comes in with his prescription for the silver alginate dressing, you will be able to provide him that dressing with the prescription from the doctor. So when the wound care quantities are being calculated, if the supplies from the Group 1 items is under $30, you can provide it with no prior approval. If those simple wound care supplies accumulate to over $30 in value, then it is going to trigger a requirement for a prescription to be provided. Okay, so it offers up some flexibility for pharmacists at that point of sale. With the prescription there, the pharmacist, or Sam, can access more benefits. So up to $200 worth of benefits without prior approval. Above that, within the 6-month period, there will be need for more information and prior authorization to obtain the benefit. So what steps do you need to take if Sam requires additional wound care beyond those limits? So like I said, it would require a doctor's prescription, but also filling out the wound care information for that pre-authorization for higher limits. Now we're going to move on, that was for the medical supplies and equipment. We're going to move on to the supplementary drug benefits.
So the new plan for supplementary drug benefits, Pacific Blue Cross will be adjudicating supplementary drug benefits for all FNHA clients. I believe you probably referred to this formulary as the residual formulary, but we will no longer be calling it as such. What we are doing is we're just describing it as a supplementary formulary that regardless of if the client has MSP coverage or not and has Plan W, everybody gets access to this formulary. When you are submitting claims through the CPHA standard, you should be putting the drug markup cost in the cost upcharge field and the dispensing fee in the professional fee field. So it's pretty standard practice for us, so nothing should be surprising here. So this is a snapshot of a beautifully overhauled provider landing page on pacificbluecross.ca/provider. And this is where, like I mentioned before, you will find the direct links to the pharmacy reference guide and the FNHA pharmacy fee supplement. So when you do get the copy of this presentation, those links should be live. The fee supplement, indicated here, will have the supplementary formulary printed, so you will know exactly what is comprised in this formulary. Some of the items may be familiar to you, certain anti-infectives, some topicals, certain eye drops, so please do review that formulary as it has changed from the NIHB residual formulary.
Thanks, Laura. So I'm going to talk a little bit about processing claims. But before I do, I just want to, again, with that supplementary formulary that is available to all FNHA clients through Pacific Blue Cross, I do want to just kind of flag for everyone. This does provide us a solution to that pesky clotrimazole issue that we've had since October 1st, 2017. That clotrimazole DIN has been added to the supplementary list for all FNHA clients. Also, the copay for the rapid-acting insulins will be addressed through this supplementary formulary as well. So this is one of the only benefits that are actually billed both in Plan W and in Pacific Blue Cross as well. Almost every other benefit would be paid in one program or the other. The supplementary formulary really is FNHA's wellness initiative solution. So this is how we're going to address our wellness initiatives moving forward for some of the pharmacy benefits. In the immediate term, we are looking at Shingrix. So as you all know, we do have a reimbursement process right now. Stay tuned. We will be looking to see what solutions we have and how we can actually incorporate this into our new plan. Now that we're off the federal system, we have some opportunities, and we really want to help and work with the pharmacists to support our clients' wellness. So when we talk about processing drug claims into the future, as we know, most of our clients will be in Plan W and having their drug benefits claimed there. Medical supplies and equipment will be going to Pacific Blue Cross. When these claims are adjudicated through our pharmacy softwares, the claim will flow through to PharmaNet, go through the PharmaCare adjudication, and items not paid will then go to Pacific Blue Cross and for payment. Okay? So we do, and in this process, for drugs, any active special authority is applied to the online claim as it is adjudicating. It is important to use the appropriate non-benefit PINs for the PharmaCare adjudication. So this applies for when you're providing medical supplies and equipment. as well as some of the supplementary formulary items. For example, we do have Narcan kits, which is a PIN. That PIN is not recognized within the PharmaCare program, so you'd have to use a non-benefit PIN to have it adjudicate through PharmaCare and have it as linked up and assigned with a proper Pacific Blue Cross PIN for adjudication within Pacific Blue Cross. Same with if it was medical supplies and equipment, it would have to be a non-benefit medical supply PIN that would adjudicate through the PharmaCare system, not be paid, and then passed on to Pacific Blue Cross for adjudication. When we talk about it, the continuity of therapy of moving the existing not yet enrolled clients from the NHB program to Pacific Blue Cross, we do have those 5,000 individuals that have claims today that are not yet in Plan W. We're going to continue on their drug therapies. There was a number of limited coverage drugs within this transition, and these drugs do require special authority. So moving forward, we are moving to the provincial PharmaCare-like program, and the processes apply, as well as Pacific Blue Cross and their program policies apply within their program. So for limited coverage drugs that will be for not yet enrolled patients who are not yet in Plan W, the coverage will exist within Pacific Blue Cross. So very similar to the 2017 transition, there are special authorities that are required for coverage. The coverage will be active in Pacific Blue Cross. There may or may not be a corresponding PharmaCare SA that is active, but we will have coverage active for these individuals for continuity of therapy within Pacific Blue Cross. To line up and now transition into the provincial processes and special authorities, what we have on this list is the drugs that may be impacted and may require special authority renewal at certain time points in the next few months. So many drugs have indefinite coverage, and you don't see them listed here. There are some medications, like the ofloxacin eye drops, or ciprofloxacin eye drops, vancomycin, which are usually on the short-term basis and provided only a short-term SA. If clients need them longer term, like every other PharmaCare claimant, a special authority would need to be renewed. We have some drugs at the 3-month window that also have to be reviewed. At 6 months, same as well. You can see the chemicals listed there, that the prescribers will be required to request a special authority for continuity of therapy at 6 months. Okay, so now I'm going to move on to the drugs for continuity of therapy that are non-PharmaCare benefits. So like in the transition in 2017, we maintain coverage. We want to make sure people who are on existing therapies continue on the therapies that they have been on. So with that in mind, there will be special authority. These are exceptional coverages that we have in place, and we are going to want to transition them with exceptional special authorities into the PharmaCare system. So you can see the drugs listed here, and there is one typo here, the Invocana, the canagliflozin. I can't say it, I'm sorry.
Canagliflozin.
Thank you. That drug should not be on this list. That will be indefinite coverage. But the rest of the drugs, the coverage will need to be renewed at the intervals you see here. On the case-by-case basis, we have some of the Hep C drugs and some of the agency medications, because we will be making sure that people are transitioning into the provincial agencies if they're entitled to. We're going to talk about the continuity of therapy for the transition for one other point. The drug benefit program is moving forward, mirrors PharmaCare drug listings. So for FNHA clients not yet enrolled in Plan W, there are several drug therapies that may require a change to benefit DINs or PINs for continuity of therapy. So when we talk about these drugs, these are drugs that may be combination products that need to be provided separately. They may be a mixture or compound where the ingredients need to be separated. This is not unlike the change that we experienced in 2017, where there's some changes that may need to be made. In some cases, it's just a change of one manufacturer's brand to another brand, or it's a change of PIN or DIN, just assigned by a different program. We are moving from the NHB program into the provincial processes. So really keep that in mind, and that's kind of the lens we have when there is a coverage issue or something that comes up. That is one of the checks that we can do as pharmacists to make sure that we're billing the benefit PINs for the program that we have moving forward. They're processing drug claims. So what I've explained so far is the happy path of the drug claims. So we're moving into the provincial system. When medical supplies or drugs are billed through the system, they will adjudicate through PharmaNet, go through the PharmaCare system, and then the amounts then will be forwarded on to Pacific Blue Cross for payment. The coverage will be set up for the drugs that we have continued coverage for. Any new drugs that are subject to limited coverage or require special authority, that special authority needs to be put into place. But if there's a problem adjudicating to PharmaCare first, and this requires an active MSP, that could be one of the stops that we have in this process. So like I said, in the process of billing a claim through PharmaNet to PharmaCare, having it adjudicated and not paid, and then forwarding it to Pacific Blue Cross, when special authority in PharmaCare exists and is approved, it will follow that claim and the claim will be paid in Pacific Blue Cross. So the challenge here that we will see at the pharmacy counter is if you're unable to adjudicate through PharmaCare. So if you're unable to adjudicate through PharmaCare, there's some things we can do. So one, that may be that client needs to be enrolled in Plan W. So that's one action we can take. That action involves the transitional coverage request form. So it's the pharmacist identifying there's a transitional issue. This form is available on the FNHA website, and you will be able to also download the FNHA MSP application as well. So with that application, you have the client sign it, provide their contact information, and submit it to FNHA by fax. FNHA will look at that information and get that client enrolled into Plan W. Pharmacists will be paid $10 from FNHA in a check, in a manual form. So that is one way to make sure that the clients can have the drugs that they need right then. So enroll the client in Plan W. If there is a drug that needs to be provided right away and you're not able to get this all in place, we can try to send claims to Pacific Blue Cross using the DA intervention code. So this you could do for medical supplies and equipment, the supplementary formulary that is available to all FNHA clients, and for the drugs not yet enrolled, where you can send the claim to Pacific Blue Cross using the DA code. So this is the same way you would adjudicate a claim to NIHB today, using that DA to prevent the claim from being adjudicated within the PharmaCare system. Okay? When you do this, though, and circumvent the PharmaCare system, any valid FAs that exist within the PharmaCare system cannot be read by the online claim that's being adjudicated. So that means there's a manual step for the pharmacist to confirm the special authority is in place and use the DV intervention code.
Some of the pharmacists are piping up. When you're saying send claims to PBC with the DA intervention code, that's the claim coming to Pacific Blue Cross. Some of the pharmacists are pointing out DE. So that's how, when you're billing PharmaCare and you're telling PharmaCare not to pay, you would have the DE intervention code on the claim going to PharmaCare. When it's going to PBC, you would have the DA intervention code to tell us you did attempt to send it to PharmaCare. Just because a lot of people were piping up right there, just to clarify that.
So again, when a claim, when it is a limited coverage drug, it would require the pharmacist to validate the special authority approval, either by obtaining a copy of the SA approval from the prescriber and having that information, or by calling HIBC and getting the information from there. And then on submitting the claim, using that DV intervention code to allow the claim to be paid by Pacific Blue Cross, confirming that the pharmacist has verified the special authority details. Okay, so I'm going to move into a case study, and this is for Daniel. His drugs and MS&E claims have been paid by the NHB program previously. He's been prescribed Vivance, and he's not yet enrolled in Pharmacare or FNHA's Plan W. He'd like to start on his drug therapy as soon as possible. So what are the therapeutic options available, and which are going to meet Daniel's needs? So really with this question, we want to take a look and make sure that he, in the pharmacist's brain, like, is this client going to be able to get this special authority? Have the first line options been tried? Are we going to move forward with the special authority, and is this drug even covered on the Pharmacare formulary? So where we would go is the Pharmacare formulary search is available, as well as the other formularies that are available to FNHA clients. There is that supplementary list. The supplementary list will not have any limited coverage drugs on it. So for this client, we do know that this drug is available for coverage with a special authority. We do know, though, if this therapy was started before September 16th, there would be active coverage within Pacific Blue Cross. Okay. So given that it started after September 16th, Vivance does require a prescriber special authority. So speaking to Daniel, we know he doesn't have any other insurance plan, and he does require a fully paid benefit. He isn't able to afford medications or copays, and that would be a barrier to him adhering to treatment. So working with a physician, we get the special authority in place. So what steps do we take to make sure this client can get a covered treatment option? Well, one, being that he's getting claims through has been getting them through NHB, and he is not yet enrolled in Plan W, we're going to take steps to enroll him into Plan W. We can encourage him to call FNHA and request Plan W coverage, or the pharmacist can support by providing the transitional coverage form as well as a signed MSP application to FNHA, and FNHA will get him enrolled in Plan W as soon as we can. It can be very quick, but if there is missing documentation, we may have to follow up with the client. But in the meantime, FNHA can activate coverage within Pacific Blue Cross so that those limited coverage drugs could be paid for this client. So again, if it was unable to be adjudicated through Pharmacare, the claim could be sent directly to Pacific Blue Cross using that DA code, and you'd still use that DV code once the special authority is in place and you've been able to validate it. Make sure you keep that special authority information available on the client's history file, because it is something that you have to have validated each time you do have subsequent fills for that drug. Okay, so I'm going to move on to some of the non-prescription drugs that are available through Pacific Blue Cross. So for the items that are available through Pacific Blue Cross, there are claims for eligible non-prescription benefits where claims will be allowed when recommended and initiated by a pharmacist. So this isn't a new conversation. We've had the same conversation with some of the OTCs listed in our Plan W. FNHA is looking at ways we can break down some of the barriers and make sure that clients can access the benefits they need from the providers that have the competencies to provide those items to them. So with the over-the-counter items, diabetic supplies, glucose test strips, EpiPens, other over-the-counter items that are available can be provided by a pharmacist. Documentation is important, and the documentation is with the date, the name, address, date of birth of the patient, name, strength, quantity of drug, directions for use, pharmacist name, signature, and license number. So it's not unlike the other prescription information or the information you would need when you're providing any other medications under your authority. Okay. I'm just going to quickly answer a question about validating a special authority every time. So when you are using that DV and intervention code for the special authorities, you need to validate that there's an active special authority. So depending on your pharmacy processes, if you record it on the patient's medication profile, you know and you should be able to trust the information that is there. Some pharmacies may choose to call HIBC and check for a special authority each time they refill it. It will depend on each individual pharmacy on how they manage that. But at the end of the day, it will require an approved special authority in place to use that intervention code. So supporting First Nations through this change. So this transitional coverage form we saw, and we introduced it for the October 1st, 2017 change as well. So this really is a tool pharmacists can use to address issues that arise because of the transition. We had it for the pharmacy benefits back in 2017, and pharmacists continue to use it today through some of the challenges when clients are transitioning from the NHB program into BC as new residents to BC and as they enroll into the Plan W program. If you're uncertain of if you can use it, don't hesitate to call us at FNHA or send us an email. But be assured, this transitional coverage request form is a tool pharmacists can use to ensure there is continuity of therapy and to ensure our clients aren't impacted by this system change. So this is a way pharmacists can provide, for continuity of therapy, the pharmacist can provide one fill of a drug or a medical supplies and equipment that the patient has been on if there's problems adjudicating it. You can provide a supply and bill FNHA manually. So you would provide a copy of the prescription, the official pharmacy receipt, attach it to this, and send it into FNHA. FNHA will look at the form. We may have a discussion around what the transitional issue was, and there may be follow-up with the client and or the pharmacy to resolve that transitional issue. And we will pay the claim as well as a $10 service fee. So I'm going to move on to talking about glucose test strips. So in our NHB FNHA residual formulary, which is now going to be our FNHA supplementary formulary, on our old list we had a pin, an NHB pin, to allow one box of strips. And we wanted this box to be available to our First Nations clients as that one step that if a client did need coverage for test strips and did not have a diabetic education certificate submitted to Pharmacare, one box of strips could be provided. And then once that claim was processed, we would have a background solution to make sure that coverage would be enabled moving forward. So that NHB pin has been removed. That does not exist anymore. We're moving into provincial systems. So an FNHA client does not have to have a diabetic education certificate in place for blood glucose coverage. If a client does not have that certificate in place and coverage for test strips, especially clients who are newly starting on strips, contact FNHA to enable coverage. Okay? Clients may choose to attend a diabetic education center, but FNHA is not making it mandatory for attendance of the DECs for coverage. FNHA will allow and recognize diabetic education provided in non-institutional settings, such as through their First Nations Health Services organizations. Okay? So in short, we really want to encourage diabetic educators, pharmacists and nurses, and others working with First Nation individuals who are newly diagnosed diabetic or are looking for strips to contact FNHA. FNHA can enable test strip coverage for FNHA clients in Plan W. Okay, so another point, as we talked about before and mentioned, that we are moving away from the NHB system and we are moving into the provincial system. So the rules for compounding as well as for other benefits follow either Pacific Blue Cross or Pharmacare. So this here is about the extemporaneous mixtures that we had flowing through NHB will now be flowing through and using Pharmacare pins.
So we just want to reiterate some key important details with regards to transmitting claims to Pacific Blue Cross, specifically reiterating the correct quantities for pharmacare claims. So there are a lot of circumstances in which we cut back claims accidentally as a result of the fact that the correct quantity was misinterpreted. So for example, for insulin pump supplies, we significantly undercut, especially if a box can contain 10 cannula and 10 tubing. It should definitely be submitted with a quantity of 20. So please do download the Pharmacare correct quantity documentation and make sure that you familiarize yourself, as we don't want to misadjudicate any of the claims that you are transmitting to us. And I know that we have talked about this time and time again, but I promise you I will get questions about where these provider resources are living, and they are living at pac.bluecross.ca/provider. And as you will note, there are the fee supplements, the provider health claim form, the wound care assessment form, the additional transitional coverage request form, the FNHA MSP application form, and any transitional FAQs. It should be noted that we are hoping to translate some of the questions that have been asked today into this FAQ so that you can have complete documentation of the correct answers.
And please check out the FNHA website for cultural safety and humility resources. There's really good information on there, like the First Nations perspective on health and wellness. As well, you've probably heard by now, there is courses on cultural safety training. So one of the top recommended ones is through SANYAS with PHSA, or the BC Patient Safety Quality Council actually has a 12-part mini-series that's available online.
All right, so we're coming up to the summary. So thank you everyone for sticking with us tonight. There's a lot of new information. Generally, the system is pretty open, and we have a very streamlined medical supplies and equipment benefits now. So we really are excited about the experience our First Nations individuals will have when they're able to access these benefits through the pharmacies. Please update PINs for the electronic claim submissions. That is going to be an important step needed to make sure the claims go through. Pacific Blue Cross will adjudicate the FNHA Supplementary Drug Formulary and the drugs for clients not yet enrolled in Plan W. If you do have clients that have always had their drugs flow through the NHB system and not in Plan W, please help us enroll them into Plan W, encourage them to contact us, or support them by filling out the transitional coverage form and submitting that with the MSP application form. That transitional coverage form, it just needs to have your pharmacy information and a description of what the transitional coverage issue is. The MSP form pretty much explains what we need to do, and we'll be able to work through that and get the client enrolled in Plan W as we intend for future billings.
So now we get to the questions, and there have been a lot of questions that have come in, so thank you everyone for being patient. We will try and address all of them. So if you asked early on, don't worry, we still saw it, and we will be answering. One that came in right at the end is, I think we should start right there, which is what policy number and client number should we enter for patients? So just a reminder that if they're covered through PBC, FNHA clients will be billed under policy 40,000, and their client ID will be their status number. They may have a Blue Cross card indicating that, but most likely they will be coming to your pharmacy with their status card. And the other question that has been asked frequently is, are these slides going to be available to download? The answer is yes. We will be sharing these slides with the participants. Hopefully BCPHA can help us with getting that out to everyone, and they will also be posted publicly on the FNHA website. Is that correct? So anyone who wasn't able to attend will also be able to view the slides. I'm going to jump into the drug questions because that's what I know, so I will start there. There was a question about viscosupplementation injections. So this is your hyaluronic acid, your Synvisc, your Orthovisc, what have you. I shouldn't use brand names, sorry, this is accredited. Strike that. Viscosupplementation. So Pacific Blue Cross will only be accepting electronic submission of medical and equipment supplies for FNHA clients. That's policy 40,000. At this time, the viscosupplementation is not a benefit under the supplemental formulary, so you would not be able to bill those electronically. We are hopefully looking for the future to expand our electronic billing, but right now the answer would be no. There is a question about coordination of benefits. So yes, the coverage through the First Nations Health Authority is the payer of last resort. That hasn't changed. If someone has coverage through employment or some other coverage through their spouse or what have you, they would be billed first before the First Nations Health Authority benefits. We had a couple questions about BC residents traveling outside of BC and whether these out-of-province pharmacies could bill Pacific Blue Cross for their benefits that are eligible through First Nations Health Authority. And the answer is yes. If they are enrolled in as a First Nations Health Authority client and the drug is eligible under the plan that they are enrolled in, and the pharmacy is enrolled to bill Pacific Blue Cross, they can submit the claim. However, if the FNHA client is covered through BC Pharmacare, they're actively enrolled as MSP, they cannot bill PBC because we are not providing their benefits for drugs covered under Pharmacare's Plan W, so they would have to pay out of pocket and submit manually or work that out with FNHA directly.
Yeah, so the message for clients that we've been telling our community members is plan ahead and try to make sure that you have the medications that you need. If you're traveling and you find yourself stuck, if you can't pay out of pocket and submit your claim for reimbursement, contact FNHA. And it's the same 855 number for clients, and we will help them with their situation.
So we've had a lot of questions about the special authority process. So I want to dig into that a little bit here. So you've got sort of two groups of FNHA clients. You have those that are enrolled in Pharmacare Plan W. They have active MSP coverage. They're getting most of their drugs covered through BC Pharmacare with a few through PBC, through the supplemental formulary through PBC. So these members would, for special authority drugs, their physicians would apply to Pharmacare. They would get the coverage through Pharmacare. The claim would never go to PBC. For the clients that do not have active MSP coverage, who are getting all of their drugs through Pacific Blue Cross, we are paralleling Pharmacare's Plan W. So any drug that would require special authority under Pharmacare Plan W would require special authority under this parallel plan through Pacific Blue Cross. Their physicians will still apply to BC Pharmacare for special authority. They will use the same forms that are posted on BC Pharmacare's website. That process will not change. What might happen is if in Pharmacare's system that client is flagged as a federal client, they will not process the claim. So if they are flagged as a BC resident who doesn't have MSP coverage, because this question came up about our ability to read these special authority codes, that we would be able to read it in that case. But if Pharmacare is outright rejecting the claim because it thinks it's a federal client that's coming through, that same information will not get transmitted. And that's the case where this DV intervention code comes into play. So if you have an FNHA client who has been approved through Pharmacare for special authority for one of these drugs, and Blue Cross is not reading that special authority, and you have verified that it is in place, that is the time you use the DV intervention code. So hopefully that helps clarify. I know there was a lot of questions around exactly why you would need the DV code. So it's trying to cover both scenarios. Oh, and one other point, the special authority is only, like I said, the drugs that require special authority under BC Pharmacare Plan W. There's no prior authorization requirements for drugs on the supplementary list.
I'll just jump in to say that we intend on having a map or a practice tool for pharmacists so they can see how the claims will flow, and that will help visualize and help pharmacists see where the claims and how they can be processed through our different programs.
Okay. And then there was a question about vitamins being covered under Blue Cross. So there are vitamins that are a benefit under Pharmacare's Plan W. So for those FNHA clients getting coverage through Blue Cross for the parallel Plan W, then yes, they would be eligible. And yes, we would accept a pharmacist-initiated prescription for a non-prescription vitamin following the requirements that were outlined in the slide that Cindy went through. This was a question for FNHA. So they were inquiring about the hours for the email address and the phone number being monitored, and how would a pharmacy manage a patient late on a Friday afternoon?
Okay, so on a late Friday afternoon, if there is no answer at FNHA, remember you have the transitional coverage form as a support. As we're going through this transitional period, we really encourage pharmacists to use that form. It helps us identify the transitional coverage issues and where the additional practice supports, or where we may need to look at our benefit program and what we may need to address. So we will be following Pacific Blue Cross's hours,
which are 8:30 till 4:30.
8 to 4:30.
Monday to Friday.
Correct.
There was a question about how to submit a claim for infants under 18 months of age. So that process hasn't changed. It would still be submitted under their mother's status number. Is that correct?
Okay, so if we have, if the mother is in, or father is in Plan W, you can submit it under the parent's PHN for claimant as you could with any other BC resident. If there's a claimant, we need to make sure that they have coverage for in Pacific Blue Cross. So you would be billing under the parent with the Pacific Blue Cross coverage. It's very, very important that the pharmacist encourages the patient and or supports that request for identifying that individual to FNHA. So if there are coverage issues for babies and infants, don't hesitate to use a transitional coverage form and or contact FNHA.
Going through some of the questions that came in while I was reading questions. Question about where to get the PINs for medical supplies.
All the PINs are published in the fee supplement. That's on pac.bluecross.ca/provider.
And there's been, on the MS&E side of things, there's been a couple of questions asking if the client has been approved under NIHB for an MS&E item, so incontinence supplies is one example. Will that approval be automatically transitioned to Pacific Blue Cross?
Yes, so if you do review the fee supplement, you will notice that incontinence supplies will create lower access or remove barriers to improve access for those types of services. And so I believe that some of the predeterminations have been removed as well for certain dollar values in addition to certain frequency limitations. And so as such, Pacific Blue Cross is going to be honoring predeterminations that are still existing on the same products and services in the fee supplement.
If I could add, just if a product still requires predetermination, we are loading predeterminations in our system and we will honor them.
I do have a point here I just want to let the pharmacist know around the blood glucose test strips. So the strip limits apply the same that exist within the Pharmacare system. So some of the medical history has been provided to Pacific Blue Cross to ease the adjudications for the medical supplies and equipment. That is not in place for the insulin. So moving forward, on September 16th, if there are claimants that are, or if there's claims for blood glucose test strips for a patient that is on insulin, to get that limit, it requires a claim of insulin. So on September 16th, there may not be a claim for insulin, okay? So when there's test strip requests in the first few months, be aware that there is a transitional issue that very well could happen for an insulin-dependent diabetic. Pharmacists will identify, this is weird, there's a transitional issue here. Don't hesitate to provide coverage, provide a fill using the transitional coverage. As we do with the transitional coverage, it's a manual claim into FNHA, but we will pay for the claim, the drug or the strip cost, the dispensing fee, as well as a $10 service fee. But just to flag for pharmacists that the insulin count and the adjudication of the test strips will be a little bit compromised in the first little while until the actual drug history evolves within the Pacific Blue Cross system.
Okay, so we have a couple questions on the insulin. Question is, do I have to wait till September 16th to utilize PBC, especially for balance for rapid insulins? Yes, unfortunately, you have to wait till September 16th. And then the other question is, will Humalog be paid partly by Pharmacare and the balance paid by Blue Cross? As of September 16th for FNHA clients, yes, the rapid-acting insulins that are subject to Pharmacare LCA will be eligible under FNHA supplemental formulary for all FNHA clients.
And this is intentional for this category of benefits only. Other benefits should only be billed within one program.
And the system will control that.
Yeah.
There's also a note here, because we are recording this presentation. Will the recording of the presentation be available?
Yeah, so the recording of this presentation will be posted onto our e-training, on the e-training portion of our website soon after the presentation is over.
There has been a number of questions about the fact that pharmacists can initiate over-the-counter prescriptions. So there is details on that in the fee supplement, including the requirements that we would need for you to document when you initiate that medicine. And questions regarding other OTC items such as Metamucil and allergy meds. So if it is available without a prescription and you are acting within your scope, you can initiate that prescription. The quantities that can be billed would follow our normal quantity limits. So in most cases, this would be a 100-day supply. For high-cost drugs and narcotics, it would be a 35-day supply, with the exception for those, well, one would not assume that a pharmacist would be initiating a biologic. So there are biologics that are 60 days, but that's moved to this point, sorry. Another question about coordination of benefits. If a client has an Assure card through an employer, yes, you should be billing the employer card first and then submit any residual to PBC. If the client has PBC coverage through their employer, we will integrate those or coordinate those benefits internally. So you would just need to make a single submission to Pacific Blue Cross, and if we are coordinating between more than one Blue Cross plan, we would send you the CPHA response code indicating that the benefits were coordinated internally. There's no need to resubmit to the second Blue Cross plan. If you do resubmit to the second Blue Cross plan, it will reject as a duplicate because it would have already been processed through all the relevant plans. Now, Cindy, I don't know if you want to talk to this one about why this change is occurring in the first place. I know you spoke to that at the beginning, but maybe
Sure.
Another touch point.
Yeah, so like I mentioned, FNHA is very, very excited about this change. This change removes the federal jurisdiction over our drug plan. FNHA we do have a partnership agreement. We are partners with the federal government in the NHB program, and we're partners with the provincial government and the Ministry of Health and their Pharmacare program. But FNHA is this transition off of the federal system is an act of is an act of self-governance, where BC First Nations are determining the access and determining the benefit program for our BC First Nations. So when we look at the work of First Nations and the reconciliation with First Nations and addressing some of the historical issues and government policies, this is a big step that BC is taking to really change the relationship of the healthcare system and the First Nations here in BC. So we're very excited about this transition, and it really opens up and creates opportunity for FNHA and the healthcare system at large to reduce the gaps that exist within healthcare today.
So I'm going to move on to some of the MS&E items. We had one question about the wound care limits, which are 20 items or $200, and wondering how that limit is applied. Is it whichever cost is lower?
And so the answer to that is whichever one they hit first, whether they hit the $200 first or whether they hit the 20-item limit first.
And then there was a question about if a claim for wound care exceeds that $30 threshold, how will PBC system respond? Will it be rejected or?
The claim will be rejected, and then, as we mentioned earlier, with some items that reject, you'll want to refer to the fee supplement, which will describe for you in the wound care descriptions that you can submit for approval over the $30 by submitting a prescription to Pacific Blue Cross.
Sorry, just going through any subsequent questions that have come in. About the infant being submitted under the parent's PHN. They're questioning about the Pharmanet profile and how that would impact that.
Yes. So it's a regular process within the pharmacare system to allow a baby to be billed under the mother's PHN. So you're right, that does create some issue with the parent Pharmanet profile. One of the best practices that we've had discussions with BCPHA and the Ministry of Health is to write for baby within the SIG field. But also remembering to change the ID or the care card number to the infant's PHN after coverage has been activated for the PHN and for the baby.
And we have a pharmacist asking about the transitional coverage and if it requires a pre-approval.
This is the beauty of the transitional coverage. The transitional coverage is a pharmacist tool to provide something immediately. So we trust pharmacists to provide this for the benefits that are eligible for patients that need those benefits for continuity of therapy, or if there's a transitional issue that is preventing the client from getting a drug that they're eligible for. So there's no pre-approval for using that transitional coverage form. If you're uncertain, though, you can contact FNHA at the 855 number, and our assessors will work through that issue with you, and they may direct you to use that transitional coverage form to resolve the issue that you have in front of you.
So there was a question regarding MS&E and predeterminations and turnaround times. So our goal is to turn these claims around in 5 business days. So pre-authorizations, predeterminations for MS&E will be 5 business days for turnaround.
Okay, so in the FAQ document, we'll provide some messaging around the billing for infants. This has always been a very complex issue at the pharmacy counter, often a Friday night issue. So we'll provide some clear instruction in written FAQs for pharmacists. So please come back and look at those FAQs for the clear, because I know if we start talking about one section of that or one there's a lot of context to that question, so we'll provide that in writing in the FAQs.
And we will also include some FAQs about pharmacist-initiated over-the-counter items, because that question keeps coming up as well. So we want to make sure that we have something written that people can reference.
So there was a question here with regards to walkers. So the fee supplement does indicate the claiming criteria for walkers, and the question was whether or not medical documentation needs to be submitted to Pacific Blue Cross for adjudication. And the answer is that you should be treating every patient who's requesting a walker with the same quality and care as you would anybody else in your facility. As such, Pacific Blue Cross does not need to see the claiming criteria associated with that, and you are able to provide someone with walking needs with a walker up to the claiming criteria indicated in the fee supplement. So we are wrapping up here with regards to questions. If you do have any additional questions for us, please do send them in. We'll just take 1 minute here to review them before we summarize some of the conversations. I see a question here about a walking boot and what the turnaround time for a medical equipment item would be. And to echo Carlos's comment, that would be a 5-day turnaround. You should download the fee supplement to indicate what type of claiming criteria is necessary for that walking boot to ensure that the client has all of the amenable documentation prior to submitting to Pacific Blue Cross for eligibility.
So there's a question here regarding, rush or express service. Will there be an option to request a faster predetermination in an urgent situation if a client needs an MS&E item as soon as possible? Hopefully these situations are occurring between Monday to Friday, between our business hours 8 to 4:30. If they are and you find yourself in a situation like this, the best recommendation at this point would be to contact Pacific Blue Cross through our call center, advise them of the situation, and we will look into, we have processes behind the scenes where we can process or handle the predetermination in-house, or we can work with FNHA in those kinds of escalated situations. So please call us at our call center, and we will work with you to try to make the predetermination process happen with as fast as possible. So there's a question regarding clarity regarding the walking boot, if it requires a preview or not.
Yes, so the walking boot does require predetermination according to the claiming criteria in the fee supplement. And the predetermination can be submitted to Pacific Blue Cross indicating the medical necessity for the walking boot, which I believe can come from a note from a physician, which also includes a nurse practitioner in all circumstances where a physician is indicated in our fee supplement, which simply indicates the diagnosis and medical necessity.
Okay, so I am going to address the over-the-counter items and the pharmacist-initiated and recommended items. So today, most of our clients are enrolled in Plan W. There is a list of OTC items within PharmaCare that pharmacists can initiate and recommend and provide without a doctor's prescription. There's a list of conditions for the drugs that exist within the PharmaCare program. Pacific Blue Cross is different with the OTC items that are listed on its plan. Pacific Blue Cross, our plan there, will allow pharmacist-initiated prescriptions and recommendations for the OTC items that are listed on the drug plan. So there is a difference between the two plans. Now that said, FNHA is, now that we're transitioning off the federal system, we are looking at our benefits we provide to our First Nation individuals. And I'll leave it at that because we are interested in moving forward and making benefit changes that reduce barriers for our patients. But right now there is differences between the Pacific Blue Cross over-the-counter items and how they're provided versus the Plan W enrolled and benefits available there.
So there do seem to be a few questions around clarification in terms of if the question regarding the AirCast is a doctor's note, and yes, when we have claiming criteria indicated, that is medical expenses including a physician's note. That in Pacific Blue Cross's language is similar to a doctor's note in the NIHB context as well, indicating the diagnosis to be able to indicate that.
And to add to that, it's because you have to demonstrate there's a medical need, is ultimately what it is. So there was a request for a specific list of the items, of the reasons it would be denied, but I think it's better to just state when it is covered, and it's covered when it's demonstrated that there's a medical need.
Okay, so there is a question here about nasal Narcan coverage. So it is listed today on the NIHB FNHA residual formulary. So the list of drugs that are available to all FNHA clients. After September 16th, the nasal Narcan will be available through Pacific Blue Cross for all FNHA clients. Also, the ampules of naloxone or the ampules and syringes in a kit will also be available through the Pacific Blue Cross for pharmacies that are not yet enrolled with the Provincial Toward the Heart program as naloxone dispensers. Nasal Narcan will be available through that supplementary formulary through Pacific Blue Cross.
If you reference the supplemental fee guide, you will see the Narcan DINs and the pins for the kit all listed there.
One moment here, we're just going to be reviewing a few more questions. So we have a question here about an off-the-shelf knee brace, which has a maximum, for example, $69. And what happens if it is determined at the pharmacy that, in fact, a $99 one is needed in this scenario? What are the options for a client and the pharmacist to do? We are accepting retail pricing, but we will be cutting back in these circumstances to claims to $69. There is options for reconsideration to this price. However, it will need to be reviewed in full by Pacific Blue Cross and FNHA for additional consideration of the dollar maximums to be extended beyond the $69 price point. So our questions are slowing down here. Again, if there's any last-minute questions, please do filter them through to us to ensure that we are answering them appropriately, or if not, continue to submit, and hopefully we will be able to respond to them in an FAQ as well.
There's a follow-up question on the nasal spray. Sorry, the naloxone nasal spray. If a patient is already enrolled in Pharmacare Plan W, and requires not the nasal spray, but the Narcan, can we still bill through PBC? The answer is yes. The supplemental formulary is eligible for all FNHA clients, so even those enrolled in BC Pharmacare Plan W would be eligible for any of the drugs under the supplemental formulary.
And just to clarify, these naloxone kits are not the ones supplied by BCCDC, but ones that we would order from our wholesalers.
Thank you. Question on compounds. Diclofenac compounded gel, that is not a benefit through BC Pharmacare.
So I can speak to that. So FNHA is very interested in continuing coverages that were approved through NHB. We will be managing those through our legacy approach at this time. As you know, in BC Pharmacare, the topical NSAIDs are not a benefit.
Can you remind me what the legacy approach is?
So the legacy approach is continuity of therapy. So people on approved therapies that we've had approved through our system, for those items, we will continue therapy for.
Question again on the nasal and injectable Narcan, if it can be initiated by a pharmacist. So both of those are non-prescription items. Blue Cross would accept a claim when initiated by a pharmacist.
We have another question here about wound care. So the question is the Group 1 coverage of 20 items or the $200 limit per year or another time period? So in summary, Group 1 coverage, you get $30 automatically to be able to provide the products and services that are bundled into Group 1. These are kind of the bandages, the gauzes, the wraps. The second group, which is Group 2, that's where the limitations of the 20 items and or the $200 limit per 6-month period is eligible. As such, the $30, if it's accumulated, will come into the account for the $200 limit. If a client requires more than the coverage that is currently available to reduce the predetermination barriers, you can fill out the wound care assessment form, indicates the treatments that are required and the estimates thereof, and we will predetermine on the treated wound care assessment plan.
All right, I think that kind of wraps up all of our questions. Like Laura has mentioned earlier, if you have any more questions, here are some ways that you could engage with us. You could either send them through FNHA at that helpbenefits@fnha.ca email address or the phone number. Contact Blue Cross through their 1877 number, and also email the Pharmacy Association at info@bcpharmacy.ca. We're also going to be posting FAQs that was mentioned previously on some of the questions that were posted by everyone here tonight, and kind of the key summaries from the presentation today. And also, like we've mentioned, the recorded version of this presentation will be posted on the e-training section of the Pharmacy Association's website, as well as the slides that were presented today. So now we're just going to move on to the evaluation piece, like I've mentioned earlier. I'm going to post the link for about a minute in the chat where you typed up your questions, and after a minute, everyone will be automatically redirected to it, and at the end is going to be your statements of completion that you could keep for your CEs when you are renewing your license. And with that, I just want to thank everyone once again for joining us today, and for FNHA and BBC for joining us and providing all this information for us.